I'm Elaine Vivens, the coordinator of the Children's Oral Health Coalition. Thank you for joining us today. On behalf of the Children's Oral Health Coalition, I would like to welcome you to our Growing Healthy Kids from Pregnancy and Beyond, What Nobody Tells You. This series of monthly conversations provides a unique opportunity for new and experienced parents to gain skills and awareness about kids' oral health, overall health, and well-being. Our goal is to help parents by giving them access to providers, tools, community resources, and topics on difficult conversations as they navigate parenthood. The information we're sharing is good for anybody that's working with parents, supporting them to help kids become healthy and safe as they grow up. Today, we will be talking about a healthy child equals success in school. The foundation for a child's success in school starts before they're born. It starts with loving parents, caring adults, and caregivers. We have a group of panelists that are here to work with us today, and they will give you some excellent tips and information on how to help your kids be successful in school. Let's get started. Our moderator today is Frances Wampler, who is the program coordinator for the Center for Children's Health. We also have Brian Johnson, coordinator with parent partnerships at Fort Worth ISD, Dr. Tanya Fuquay, director of oral health at the Center for Children's Health, Myra Mclaughlin, Title I parent facilitator at Arlington ISD Parent and Community Engagement Department. And we also have Otis Goodwin, Director of Family and Community Resources at Fort Worth ISD. So we'll get started with Frances Wampler. Can you share with us what adverse childhood experiences are and how it impacts kids in school?
Thank you so much for this opportunity. I'm so excited to be with you all this evening. And I just want to welcome everyone to our conversation. As Elaine mentioned, I am a program coordinator here at the Center for Children's Health, led by Cook Children's, and my team focuses on adverse childhood experiences and child abuse and neglect prevention. Today, I'm going to give us an overview of adverse childhood experiences, why those are important, and how they can impact your child's success in school. So this first slide, I'm just going to use this to help us define adverse childhood experiences. And I've said ACEs several times, but that's our acronym for adverse childhood experiences is ACEs. And ACEs are potentially traumatic events that occur in childhood. So the ages from 0 to 17, some of those can include experiencing violence, abuse, or neglect, witnessing violence in the home or in the community, and having a family member attempt or die by suicide. This could also include different aspects of the child's environment that can undermine their sense of safety, stability, and bonding, such as growing up in a home with substance use problems, mental health problems, or instability due to parental separation or household members being in jail or prison. This is the infographic from the CDC Kaiser Permanente ACEs study that we like to use just as a visual to give you an idea of the study that started when we started looking at adverse childhood experiences. It was one of the largest investigations of childhood abuse and neglect, household challenges, and the impact that those had later in life and the connections that they have to our health and our well-being. The original ACEs study was conducted at the Kaiser Permanente from 1995 to 1997, and it has some ongoing data collection tied to it. This study evaluated 10 categories of ACEs along the lines of abuse, neglect, and household dysfunction. If we take a closer look at adverse childhood experiences, there are other adversities that children may experience that CDC Kaiser Permanente study did not include. Some of those are things like the COVID-19 pandemic, death of a parent or caregiver, deportation or separation, victimization by crime, bullying, experiencing homelessness, witness to neighborhood violence, caregiver having job loss, and even having a family member die by suicide or experience some sort of attempt. Some of these examples have been researched as an ACE, whereas others have not. But authors believe that there's evidence for looking at ACEs from the ages of 10 to 16 in two general categories: child maltreatment and peer victimization, which would include things like physical, sexual, emotional abuse, physical and emotional neglect, as well as those peer victimization things like bullying, spanking, or exposure to intimate partner violence. And the other category of household challenges. So someone in the household experiencing substance use, depression, mental health concerns, CPS involvement, being placed in foster care, experiencing poverty, or even neighborhood safety. If we take another closer look at ACEs and we think about the lasting impact that they have on our health and well-being, we can see that ACEs have a long-term impact on our overall health and can be linked to chronic health problems into our adulthood. Some things like mental illness, suicide, and anxiety, having an impact on your maternal health and future generations, cancer, diabetes, infectious diseases, injuries like fractures or traumatic brain injuries, experiencing risky behaviors like substance use and unsafe sex practices, as well as having negative impacts on education, job opportunities, and even earning potential, which is a big focus of our conversation today. All right. Something we know for sure is that ACEs are preventable by creating and sustaining safe, stable, and nurturing relationships and environments for all children and families. In doing so, we can help all children reach their full potential. On the right side of the slide, I think if you click one more time for us, Elaine, you'll see an infographic from the CDC on preventing ACEs, and you can find more information on their website. As we stated earlier, ACEs are preventable, and we like to take a look at positive childhood experiences here on my team and explain how that can really counteract the effects of ACEs. What we know for sure is that positive childhood experiences before the age of 18 are beneficial. These relationships are key to creating positive childhood experiences where children can thrive and have access to safe, stable, and nurturing relationships, as well as encouraging positive childhood experiences shows reduction in cases of depression, heart disease, and obesity. It can really lessen those long-term harms that we've already talked about. We always like to give an example, and one of the examples that we talk about with families is special playtime, making it a priority to carve out time to play with your children in your life. Play is a child's language, and it's crucial to a child's development. It teaches children lessons and prepares them for many adult roles. Some toys and activities for special playtime would be things like blocks, coloring books, crayons, figurines, Play-Doh, anything that you have accessible at home you can use for this time during the day. And some tips when trying to incorporate special playtime into your routine is just spending 5 to 10 minutes every single day and being consistent, letting the child lead the conversation and then praising them for good behavior. What we do can make a difference in the lives of our children and the next generation. Parents and caregivers can establish a routine, set time aside each day to talk and to play, stay connected to your child's providers and educational team. As friends, families, and neighbors, we can develop nurturing, supporting relationships by offering support, being a listening ear when someone might need a little extra help. And everyone can recognize challenges that families face and offer support and encouragement to reduce stress, promoting values that discourage violence in the home and in the community, and participate in local activities to stay connected. Now that I've given you a brief overview of ACEs, I do encourage you to drop questions into the chat. We'll be able to circle back to these questions at the end as we move through each of our panelists. We want to be sure that we're asking the questions that you all have in mind as well. And our first panelist is actually going to be Dr. Fuquay. Dr. Fuquay is the director over at Child Oral Health Team under the Center for Children's Health within the Cook Children's Healthcare System. She's a general dentist and very passionate about oral health of children and pregnant teens and women. Dr. Fuquay actually founded Save a Smile, an innovative, nationally recognized initiative that provides preventative and restorative dental care to children from low-income families from select school district. Dr. Fuquay, we're so excited to have you join us. Can you tell us, how does oral health fit in with attendance and a child's success in school?
Thank you, Frances. I appreciate the introduction, and I'm excited to be here with you all tonight. People do not typically think about oral health being an impact of kids being in school, being able to be healthy, not in pain, being able to study and learn without having dental issues. So back when Save a Smile started, I'll give a little bit of information and history of why Save a Smile even became into existence, is because the school nurse administrator from Fort Worth ISD was saying, hey, one of the top reasons kids are missing school is because of dental pain. And we were privileged and lucky enough to get to work with an organization called Communities in Schools to be able to use a social service component to help us to get access to kids. So statistics that is really daunting to most people. A lot of people know about asthma. They know how detrimental asthma can be. School nurses have to deal with patients with inhalers and asthma medications in school to make sure that they are able to function and breathe and be safe in that school environment. But people do not realize that actually dental disease, dental caries, cavities is 5 times more common, and one of the number one chronic childhood diseases of our kiddos is dental decay, cavities. People just don't think about that. And I don't know about any of you all out there listening tonight, but if you've ever had a dental toothache, it hurts. You can't concentrate. And maybe you have not had a toothache. You've probably had a headache before. And you can't concentrate. Anything in that head and neck region, you are just not functioning at your strongest suit. You are just having a hard time just concentrating or feeling well. So think about our kiddos sitting in a classroom trying to learn. They're not able to if they have a toothache. Well, another thing that happens with kiddos is teeth are not just about being there to eat, to smile, to look at. Teeth are about function. You need teeth to be able to eat. You got to have good nutrition. You're not going to be able to stay well and in school if you're not eating well. You have to have teeth to be able to speak and learn to talk and enunciate and pronunciate those words and vowels when you're little and learning in kindergarten. It's also another thing about teeth is the fact that people don't realize it's not just about what they do and function, but how you feel, and that this part of the body, the mouth, is connected to the rest of the body. And it's the entryway to the body. So it's going to help us to be healthy, or it's going to cause us problems if we're not healthy, right? So we've got to eat and drink. I think most people think about food, the things that we eat and drink to keep us healthy, but it also affects the teeth, right? Not just your body, but your teeth. One of the most common things I think Elaine was talking about to us earlier this week was just about seeing a statistic about how much sugar is in cereal and what do a lot of our kids eat before going to school. It's a fast meal. It's served at schools, but we have to be careful of the sugar content that's in there because it can be more than soda or candy that's in cereal. And with sugar, not only is that going to affect your body, that's going to affect your teeth, but sugar is also going to give you that quick rush and then crash. And kids need to be able to stay sustainable, learning, healthy, being able to go. And of course, our teachers don't want our kids being little bumblebees running and jumping around in class. They can't learn from that either. So sugar's not good. The other thing we want to talk about And it's already been said by Francis, but this is going to be an astounding conversation that happens tonight, is routines. Routines is so crucial and helpful to kids. And that includes brushing their teeth, flossing, doing those morning routines of brushing your teeth before going to school or brushing your teeth at night before going to bed. That is part of your normal routine. We also like to talk about a routine of seeing your medical or dental provider once or twice a year. For sure, for dental, we want you to be seen twice a year for a dental checkup and cleaning to make sure that you can get checked out before there's a problem. Prevention is key to anything, especially with our kiddos. Kids do not always associate dental pain with a problem. They don't even know they're having a toothache. They just know they don't feel good. They're not wanting to go out and play. And sometimes parents realize that they're not having that normal routine, and parents can't even figure it out that that's what's going on. So dental is so, it's not thought of all the time in part of a health, but it's also not thought of whenever you're thinking about routines and keeping kids healthy and in school and just being a kid, right? So very important to talk about that and connecting that. One of the things that I'm just going to show, and I know you can't see it real close here, but this is our journal of the American Dental Association. I literally got this journal yesterday, and one of the biggest quotes is, "What has happened to our children's oral hygiene and oral health during COVID-19 lockdown? We lost our routines." So there are already studies showing we are in a crisis right now with children's oral health. And just to close it out, to show that need to continue to have oral health as part of your normal daily routine and connect it to your overall health, is giving the statistic of Save a Smile. We are in our 19th year of running Save a Smile. This year of 2022, of screening, this 2021-2022 school year, we screened less kids because we weren't getting the consents necessarily, parents being concerned or worried about consenting to be screened in school. We screened less kids, but we've got hundreds more that are in dire need. They are in the most severe classification. And that is sad. And we Save a Smile is only in 21 elementary schools in 3 districts. And we have well over 500 children that are considered in a severe situation. That is abnormal. So we need to be talking about these crucial things to keep our kids healthy and in school and learning. So I'm very excited that I was invited to be a part of this panel and that we are talking about oral health for the health of our kids and the safety of our kids, and for kids just to be kids. So I will stop it at that. Thank you, Francis, for letting me be a part of this, and hopefully we can continue the conversation and answer some more questions as we go through.
Thank you so much, Dr. Fuquay. You're right. We don't always think about how oral health can hinder a child's ability to learn, but I know when I don't feel well, I'm not focused on anything, right? Other than I just know I don't feel good. One question I have for you, Dr. Fuquay, is what do you think is the biggest challenge for a child to get screened at a school or follow-up treatment?
I think that one of the biggest challenges that we definitely realized, especially this year because of COVID, is in Texas, we have to have an active permission slip to do a dental screening. So if a parent does not physically sign that consent form to allow a dentist to look in their child's mouth, then we cannot do that. So first of all, it's informing and educating and getting the word out about the importance of having a dental screening, the importance of their child being looked at by a dentist to see what's going on. But this year with COVID, I think parents were a little nervous about signing that consent, because their kid had to take their mask down and have to be able to have a dentist look in their mouth. So I think that was a hindrance for us. And a lot of programs were not able to even do dental screenings this last 2 years because of COVID. So I think as we're going back into a little bit more normalcy, I think a lot more normalcy, and masks are not being worn in the school. I think it's definitely very safe, and precautions are being put in place. Whether you're going to a dentist office or whether some organization or program is coming to your child's school, please sign those consent forms. Those school districts will not let someone in there that is not or should not be there. Trust me, I know. I've been working with these districts, and they are very cognizant of who they allow to come in to touch the children in the school. So parents, sign those consent forms, or please make sure that you take your kid at least twice a year to see a dentist to be checked out.
Thank you so much, Dr. Fuquay. I know that COVID has put so many challenges for families as we've gone through these last couple of years, and hopefully we can start to get back to some sense of normalcy together and back on at least a routine and getting kids their checkups that they need. So thank you so much.
Mm-hmm.
Before we move to our next panelist, I just want to piggyback off of something that Dr. Fuquay said about asthma. And I would like for Marquita Jones, who's joined us, to share briefly about how she is supporting school nurses with asthma and give us a few tips on what parents can do. Marquita?
Hello. Thank you, Francis, for having me. And Elaine, thank you for inviting me. I'm Marquita Jones, the program coordinator for the Healthy Homes Asthma Program with the Center for Children's Health. Our program is an asthma trigger remediation program. So we discussed how to identify triggers in the home and in your environment. We try to help families educate themselves on what their child's individual triggers are. We also are part of the Asthma 411 program in Tarrant County. So that program is an initiative to support nurses and children with asthma in the school. And so we're able to provide rescue medication and supplies to those children that are in need or having an asthma attack or asthma flare-ups, to try to eliminate them from missing so much school. I know school attendance is a major issue, and that's one of the main reasons why children miss school is asthma. So we want to try to make sure the parents know, know exactly what triggers their children have, as well as the school nurses, teachers. I know that sometimes mold can be an issue in the schools, or strong smells, different things like that. It could be a trigger. So it's good for the parents and the nurses and staff, or teachers and staff, to know what environmental triggers could possibly affect their asthmatic children.
Thank you so much for sharing with us, Marquita. I love all the things that you all are doing in the community and with the school district. My middle son was just diagnosed with asthma this last year, and so I was so thankful to be sitting next to Marquita when that happened, because I had all the questions. So thank you so much for sharing that with us.
Thank you for having me.
All right, our next panelist is Myra Mclaughlin, who is the Title I Parent Facilitator in the Parent and Community Engagement Department at Arlington ISD. The department offers a wide variety of workshops, such as It is Bullying and Bad Behavior, Establishing Routines, Summer Learning, and Unpacking Resilience in Children, just to name a few. Myra loves helping families navigate parenting and school, which is a really big job. Myra, it's a pleasure to have you joining us this evening. If you would, please tell us why it's important to have consistent routines and schedules for children.
Okay, good evening. Thank you so much. I am Myra McLaughlin Sutton, and again with the Parent and Community Engagement Department for Arlington, or in Arlington ISD. And I'm also a licensed master's level social worker. So like she said, love helping families of all, with kids of all ages, from elementary through high school. High school is pretty much my passion, but I definitely want to help lay the groundwork for families to set routines, because we know if families set routines at an early age, they are more likely to follow them throughout their lifetime. And so I just want everyone on to just think and kind of close your eyes and think about, do your mornings feel rushed and chaotic? Do you feel overwhelmed and frazzled during the morning and evening times with your family? If so, establishing routines may help with a very smooth transition from one activity to another. You can open your eyes. I know that establishing these routines may seem hard. However, if you establish those routines, it will make your life so much easier. And so as we go through this evening, I hope that I'm able to provide you with some tips for establishing routines. So all those parents that are on in the chat box, let me know if you have routines, and you can indicate yes, no, maybe you're working on it. So let me know in the chat box. So I want to hear from our listeners. Let's see where you are. Let's see how many of you actually have established routines. And friends have helped me out. I'm trying to see if I see anything in the chat box.
I am monitoring the chat as we speak.
Okay, maybe they're on. Yes, for the most part. Okay, I see a yes for the most part. Well, don't fret. If you don't have a routine, hopefully I'll be able to provide you with some information for those routines. So studies have documented that schedules and routines influence children's emotional, cognitive, and social development. If they're predictable and consistent schedules for children, they will feel secure and comfortable. Structure and routines teach children about discipline. And that's that word that we don't often think about, but it's how do you want to guide your children? So again, if we lay that foundation early, they will have that information for a lifetime. It just won't be for right now in this season. Additionally, it will allow your children to know what to expect next. And so when we think about everybody on here, I need to know what's going to happen next. I don't know about y'all, but I need to know what's going to happen next. I don't like things left on the unknown, and it makes me nervous. Kind of like being on this panel this evening, right? And so we want to make sure that we know what's going to happen next. It will also reduce the frequency of behavior problems because, again, they know what to expect. They know what's coming next. So there should not be really a big discussion about it. And if it is, we'll provide that discipline. So we're guiding them in the direction in which they need to go. It will also increase performance at school because guess what? They're able to work with a group in an organized fashion. It will also teach your children about independence, how to be independent. And we all want our children to be independent. Some of us probably want them to go ahead and move out when they're 18. The rest of them can come back after college and live for a couple years. But at the most, we want to say that the foundation was laid for them to be independent. So keep in mind, children fear the unknown. However, they thrive on that consistency. Even when they don't want it, they're pushing back. They're like, no, get away from me. I don't want to hear it. But guess what? They thrive on consistent routines. And so that's super, super important. So when we think about why those routines are helpful for parents, I want you to know that it will lower your stress level, because you have someone to help you do those extra chores that are at home. One of my coworkers in our department, she says that she'll tell her family, stop, we'll take a few moments and everybody has to pick up 20 items. And so guess what? She has 5 kids and a husband. So that's 7 people picking up 20 items. And so they get everything cleaned up in a hurry. So they have that routine set in their house. And I thought that was a neat idea. So for all those parents out there, you tell them stop. It's like stop, drop, and roll, right? But we're not stopping and dropping and rolling. We're just going to stop and we're all going to do some type of routine. It will also help you as a parent feel more organized, which I think is super, super important for parents. It will also help you not be the bad guy, as they'll say, oh, you're just being mean. No, these are the expectations that we laid out. So I think that's super important. And it will also help you have quiet time. So as we move through, we will also talk about the bedtime routine. They're so hard for parents to establish because, oh, it's still light outside, Myra. I don't want to put my kids in the bed before the sun goes down. No, it's okay. We want to make sure they get enough sleep. So we'll show you a sleep chart in just a moment. So also think about what types of routines have you established. And as Dr. Fuquay mentioned, you got to have that time to brush your teeth. You should brush. She didn't go into these many details, but you need to brush twice a day for 2 minutes at a time. You see, she's 2 minutes at a time. You can have them sing songs while they're doing it, but at least twice a day, 2 minutes at a time. And as they get older, you also want to make sure that they're flossing. And so you can establish morning routines, evening routines, things that happen at dinner time. So is that a phone free or a media free place for you? They know what to expect. And so that's a great time for you to check in with your kids to see how their day actually went. So that gives great family bonding time. And so I also want to let you know, those toddlers that you have at home, I know you're saying, what is she going to say about toddlers? Yes, those children as young as 2 years of age, they should be taught routines. Actually, you're teaching your baby that, right? They have a sleep time that they get up. They're pretty much on that type of routine. But your toddlers should have routines that include chores. And you're thinking, what kind of things are they going to do? They're going to pick up their toys and they're going to put them away. They're going to pick up their clothes. They're not just going to get undressed and throw them across the room. They're going to pick up their books and they're going to put their books back on the shelf. You're going to teach, again, your toddlers the same thing that you would actually teach your elementary school children and your middle and high school children. So when we think about routines, remember, you are laying the foundation for the future. So think about parenting now for later. Again, we want our children to be independent people when they get older. I also want to talk about summer routines. So as the school year comes to an end, it is important that we keep those skills of academic sharp over the summer months. We do not want to see that summer slide, right? So we want to keep our kids focusing on writing, science, reading, and math. Research states that children from low-income families lose 2.6 months of grade level learning in math and 2 months of reading over the summer months. I want you to take note, though, any child has the potential to lose. So it doesn't have to just be low-income families. It's any child. If we focus on no academics over the summer months, all children have the potential for learning loss over the summer. And sometimes it's just due to access. So as we think about this, and if you're on with me now, you can tell me, how many books do you think children should read over the summer months? And I'm going to try to share my screen so y'all can see, but I'm not going to give you the answer yet. So if you're on with me, tell me how many books you think children should read over the summer months. And those that are going to watch this later, you just be thinking until you see the answer come up. I see 10, I see 5, I see 55. Wow. Okay, well, we know what Dr. Fuquay's daughters had to read a lot. And so I see 8 and I see 20. So let me share my screen with you so I can show you. So they should read at least 6 books over the summer months. We want to make sure that those children are reading for 20 minutes daily and that they are reading for fun. Oftentimes you may hear that denoted as the right fit book. So when we're talking about fun, it's something that your child is interested in, any genre that they are interested in. And so we talked about learning loss over the summer months as it pertained to math. We want to make sure that they play grocery store games. So keep them engaged while they're in the grocery store. Talk about weights. Have your children look for things of certain sizes, certain shapes, certain colors. Have them weigh things out. We want to do those grocery store games. If you have older kids, have them create a shopping list. And then you can also play table games, Uno, cards, dice, dominoes, and then you can also cook together. Those are all great ways to establish routines in your home. And so just remember, our main goal is to keep those skills sharp over the summer months. So summer vacation is over. So now what? What do we do? What do we do when that summer vacation is over? Anybody in the chat? Let's see, I'm looking to see if there's anything in the chat. So I don't see anything. So the summer is over. So what we're going to do is we're going to begin establishing those routines for the upcoming school year. Yes, it is now the end of July, 1st of August. We're going to sit down with our children and we're going to discuss the transition process and expectations. We cannot just assume that our children know, you know what, school starts in 2 weeks. I should start going to bed at 9 o'clock. They're not going to do that, right? Not going to happen. They're going to still stay up to midnight. You're going to have to wake them up, shake them. So we want to make sure that they actually get a good night's sleep. Not only do our children need to get a good night's sleep, but you as a parent need to get a good night's sleep. So just think about this. A Harvard article states that a good night's sleep is key to brain development. So keep that in mind. Also, make sure that you are taking those devices from your children at least 30 minutes before bedtime, because that blue light that is emitting to them, it disrupts their sleep pattern. So if you have a child that is struggling with routines, you might consider making a routine chart. Think about the 5 things. So 5 things that are most important that you need to take care of. So those could be those big rocks, the things that are most challenging for your child. And you want to do those things first, if that is what needs to happen with you and your family. The most important thing is just really about establishing a routine that is good for your family. That's a homework time, that's dinner time, that's family night, game night. But it needs to be what is best for your family. So now that we've discussed establishing all of those wonderful routines, we got to put those into practice. But what I want you to do is breathe first. Give yourself grace. If it's something that could be put off until tomorrow, put it off. It's okay. We're flexible, but we still want to make sure that we're consistent. So we're going to be consistent in our bedtime routines, and we're going to be consistent in the time that we wake up. And so I'm going to show you 1 or 2 last screens that is super, super important. And you can definitely download this information and be able to see it. But if you see here, hopefully it'll click, we have a sleep chart. And so the sleep chart indicates that children between the ages of 5 and 18, they need anywhere from 11 to 8.5 hours of sleep every day. So we back out the time that they wake up and the time that that's the time they will need to go to bed. So if they're 9 years old, and they get up at 7, then they would need to actually be in bed by 9. Lastly, reading resources. So if you like to read, Kids, Parents, and Power Struggles will be a great book. Parenting Without Power Struggles is another great book. So again, please make sure that you are establishing those routines. Remember, you are a mirror. Your children are watching, and they will follow your lead. If you make school and routine sound exciting, they will follow your lead. My name again is Myra Mclaughlin Sutton, and I work with the Parent and Community Engagement Department in Arlington ISD, and we hope to maybe see you in the future at one of our virtual workshops. Thank you.
Thank you so much, Myra. I know you don't always realize that keeping up those learning routines through the summer, like how beneficial that's going to be. And once you get in those routines, it's so good for your kids, and it's good for your own self-care too. When kids go to bed on time, mom and dad go to bed on time, right? Talk to us a little bit about how a parent's belief and attitude about the education factor into the child's ability to do well in school.
Right. So as you heard me say that your children are watching you, and you literally are that mirror. So if you have a positive attitude about reading, a positive attitude about math, even if it's something that you can't help them with, but you have some type of solution, then they know that with your help, the two of you working together. And I like to do what we call a pyramid. When you think about the child being at the top, the child is at the top, you have the school and the parent at the bottom. They are the base to be able to support those children. And so when you have that wraparound service, anything can happen. So I think that as long as you're working all together in unison, then they will push forward and be able to establish those routines, especially when it comes to academics in the school.
Yeah, that's great. We call it deer time at home here in my house during the summertime, and it's drop everything and read. And I have 3 boys at home, and I just tell them, I don't care if you have a pillow or a blanket, or you sit on the floor or you sit on the porch, but you find your favorite book and we're going to get comfortable and we're going to read. So I think those are really great tips for staying in a routine for summer. Thank you so much, Myra.
Thank you. I'm gonna steal your idea also.
Go ahead. I think it was something from whenever I was younger. It's just ingrained in me. And so I've continued to use it. So hopefully we're making progress together with that.
All right. Thank you.
Thank you. Our last panelist is Otis Goodwin. Otis is the Director of Family and Community Resources at Fort Worth ISD. Family and Community Resource coordinates supportive healthcare services addressing the physical and emotional needs of Fort Worth ISD students and their families. Through community partnerships with JPS, UNT Health Science, and the Mental Health Connection of Tarrant County, they have a network of 4 family resource centers based in communities close to students and families. Thank you so much for being with us, Otis. Can you tell us what you do to support students in dealing with bullying, trauma, and mental health issues?
Sure, I'll try to be brief with that because that's a big topic. that we spend a lot of time on. So I think the thing to remember is the school asset hub does have a tremendous amount of resources available to families, and we're constantly engaging families and partnerships like what Dr. Fuquay mentioned with the Save a Smile partnership, and I want to touch on a few other ones that we have. So basically, through our work is we want to make sure that every student has access to quality health care, whether that's vision, dental, physical, and behavioral health. So we work day in and day out to make sure that all of our students can get their health needs met. And the reason for that is because healthier students perform better academically. And that's what we're talking about tonight is that piece. Because when you're not feeling well, or when you have this ongoing issue or challenge of bullying or past experiences, those impact willingness of kids to be at school and have success. And if they're not having success, sometimes they start to struggle and they start to get down on themselves, and that makes them a little less likely to come to school. So we want to make sure that we can address those needs with families and assist them, because it's not an easy world to navigate. When you're looking for care, it's difficult for everyone. Unfortunately, I wish it was a lot easier, but I want parents to know that that most districts have the people like myself that will assist you in finding good resources for you and your family. So some of the partnerships that just touch on, mentioned UNT Health Science Center. They've been a great partner for us over the years. But they have a pediatric mobile unit that they come out to our campuses, kind of similar to Save a Smile, and they provide well child visits. They do vaccinations, but they're a great provider. There's a pediatrician on board, and they'll come to the campus, and it's the same thing where the parents have to consent to it. Everything we do is through consent by the parents, right? So we're not going to do anything unless the parent has consented for that. We have a vision partnership that is expanding. We do screenings in all the elementary schools and exams, and we have a vision van that actually can even make eyeglasses that, where they give the students after the exams needing glasses, where they'll get those students the glasses that they need. And we're looking to expand that, hopefully, to make that available for the upper level schools too. But that's a great partnership. Primary one with that right now is Alcon, who I think in the first in the nation that will have a school-based optometry center opening up next year for those kids that need higher level vision care. We have what we started over the last 2 years, especially with COVID, is a partnership with telehealth, and that's through our nurses' office. We have about 55 campuses currently participating in that, and we hope to continue to grow that. But basically, what happens if you have a kid that's coming in to the nurse's office is not feeling well, then they're able to do a telehealth appointment, and then with that, they're going to address that need of the student. And what we found when they're coming into the nurse's office and they're needing kind of a little bit more care than what the nurse can typically provide is that we're getting about 50% of those students back into the classroom, which is great because, they need to be there to be able to succeed. And then finally, on the behavioral health side, we have our family resource centers that's been in place for about 20 years now. And Fort Worth IC was one of the first to start this process. But basically, we want to help any child that's may need those behavioral health services. So families are able to self-refer to us. A lot of the referrals come from campus personnel, and we'll sit down with the families, and we have licensed clinicians that will do that and just talk about what's going on. And they will actually do the work to connect that family into the right resources. And we're very knowledgeable of the local resources, and we actually have many of those services provided on site with us. Briefly, in regards to trauma, we've really in this community worked hard to become more trauma informed across the hospital system, school systems, and everything. So one of the things of the program we have that was kind of started with TCU called TBRI is kind of to establish these trauma informed classrooms. So in a lot of the classrooms, especially in the elementary, you'll have like what I call a composure area. They may be called calming areas and things like that. But basically what we want to do is help children manage their emotions, because what we call self-regulation, if a kid is dysregulated, they're going to have a hard time learning. So we want to help them to be able to stay into the classroom where they're not necessarily having to go outside, but there's space in the classroom where they feel safe enough that they can go and take some time. And I just would ask them, okay, what do you need to do to get yourself ready to learn? So they may need to go over there and take a break and just get themselves a little bit situated, and then they come back. But they're learning those self-management skills to be able to manage their emotions by doing that. And we've rolled that out where all of our high school counselors are trained. A lot of our teachers, majority of our principals are trained in trauma-informed classrooms at schools. So that's been a big push that we've had over many years. We have a department that manages the crisis, but also do trainings throughout the district and community on trauma to help educate everybody. Last but least, just real quickly on bullying, that's been an ongoing issue probably since we were all kids. I think when we were, for me a little bit older, we kind of always think of that physical bullying. But bullying has changed a lot over the years. But the kind of the basic definition I want you all to remember is when you're getting bullied, there's a difference in power, right? And that power can come from a lot of different ways. So if someone is online and they post something that's negative, that online bullying is kind of like a social bullying, because you have a lot of other people that are witnessing that, right? And we talk a lot about bystanders, because that's been one of the most ways to be effective in decreasing bullying. Because if you notice now, and you'll see things online, as soon as something's happening, people break out their cameras and they're not doing anything, but they're kind of facilitating that stuff going on rather than putting a stop to it. Because what we've seen is if there's kids that kind of did something different that said stop, we don't like this, then that takes away that bully's power, and that's a very important thing to focus on. But as far as the process, typically within schools, every school is going to have a bullying policy. Parents have to talk with their kids. Kids may be hesitant to talk about that with them, but I think anybody they talk to about it, we're going to talk to the parents. If a parent hears about it, they should go to the school counselor primarily, or administrator, whoever they feel comfortable with going to and addressing that issue. And then the school is required to respond to that issue. So we do that day out. And then if a student is needing something a little bit more, we'll typically connect them into Family Resource Center if they're needing some additional counseling or things like that, depending on the situation. And again, with the trauma piece, it's kind of the same. All the providers that we come in are trauma informed. We have probably the one that does the most trauma work with us is the Women's Center. They have some great trauma informed therapists that really understand trauma and able not only to support the student, but they also educate the parents on trauma. So we're going to do whatever we can do from in the classroom to the community to support that family.
Thank you so much for sharing all of that with us, Otis. I know some of those things can be really challenging for parents. Can you speak to how important self-care is for parents for a student's education?
Yeah, and I think Myra did a great job talking about this, but we kind of all need those things as parents. We need some structure, we need routine. And I call it the basics, but it's really not. So when we look at self-care stress, the basics is eating, sleeping, and exercise, right? So those are the three things that are the biggest influences of anybody's mood. And so as we become stressed, a lot of times one of those areas will kind of start to cut corners on, and then they start to impact the other areas, and then our body starts to wear down. So the basic thing that when we're having those stresses throughout life, we need to really remember that eating, sleeping, and exercise, because during those times, it's really more important that you keep those routines and try to keep that health to be able to manage that stress, because what will happen is our bodies will wear down. I know there's a lot of different like self-care that, people take time for themselves, go on walks. That's going to vary from person to person as far as kind of what re-energizes them. Those things are really important too. But basic thing again is just that sleep, eating, and exercise. And those things are hard. The more stressed we become, the harder it is to do those things. And we usually have one or two of those that really make it challenging for us.
Yes, thank you, Otis. I agree. When your stress gets high, it's really hard. So it's important to take time for yourself and remember your own self-care, and that we can't give if our cup is empty.
And this Cook had a study on this that I thought was really great, in that over the pandemic, about 20% of people have put off their healthcare needs. And that's everybody from kids to adults. So a lot of what's happening is when we're putting off those needs, by doing that, people are coming in with a higher level of need because it hasn't been addressed. And that's across all the healthcare world, that, when that's put off, it just makes the situation a little bit harder to deal with.
Yes, absolutely. It's very important for us to remember to take care of ourselves so that we can take care of others. And I know the pandemic made that really difficult. So hopefully we can start moving in the right direction and making sure we're taking care of our children and ourselves. All right, Brian, welcome. Brian is a coordinator with Fort Worth ISD Parent Partnership. He's been an educator for 20 years, and he is helping to build the Parent Partnership Department from the ground up with the goal to increase family engagement across the district. These duties include supporting and training all campus FES positions, specialist positions, and lead parent educators. Welcome, Brian.
I want to talk to everyone a little bit about what we do in the Parent Partnerships Department, and some ways we're trying to really attack chronic absenteeism. I'll just read this short definition that we have listed on the PowerPoint. Generally speaking, students who miss a defined number of school days, usually about 10% or about 15 to 18 days in most school districts for any reason, are considered chronically absent. Now, as you look at some of these things, we're trying to make sure parents understand the differences between an excused absence and unexcused absence, and absences that may come forth from disciplinary reasons. But I think all of this needs to be really analyzed as we look at, how we're coming out of the pandemic, and as we're having the parents come back onto the campus, and how this affects the social emotional learning abilities for students and sometimes parents, because they also have a learning curve because they're back in gear as well with the kiddos. So that's just a short synopsis of some of the things we're trying to attack, and making sure we're keeping data on our Qualtrics database in Fort Worth ISD. You can go to the next slide. Just some numbers on basically how does excessive absenteeism affect a child's academic progress. Now, this varies from different grade levels, but one thing we do try to focus on is when those students miss those primary grade levels, especially pre-K, kinder, and first. And so, as we know, the pre-K enrollment can also predict our overall enrollment in Fort Worth ISD over time. And so we just try to make sure we hone in and let the parents understand that almost 1 in 10 kindergartners and first grade students nationally are chronically absent, missing nearly a month of school. Now, I myself, I was a principal for 8 years, and I've seen kids in pre-K, kinder miss 30, 40 days because some parents don't understand it. Oh, it's only pre-K, kindergarten is not required in the state of Texas. That used to be a thing. And so they really don't take those primary grades serious in some instances, but we really, really try to push that in Fort Worth in our department to make sure we're looking at those the absenteeism, chronic absenteeism in those early grade levels. And I think, as you can see on the last bullet, children with identified learning disabilities are especially vulnerable to the impact of absenteeism, because when you miss school, they miss those minutes that are embedded in the 504 plan, the IEP plans, where they are receiving that special support and extra support at school. So we try to make sure parents are really educated. We're working as a team, or we're not talking at them, we're talking with them to make sure we develop a plan for all of our students. A secondary level, being on the parent engagement side, as a coordinator, I've been to almost every high school and every middle school in Fort Worth. And when we talk about attendance, it is quite alarming at the middle and high school levels, because as it states in the top bullet, by the 6th grade, along with the GPA, it is the top predictor of dropout rates. And also chronic absenteeism is more common in high school. This was shocking to me because I know kids really like to socialize, and they have less reasons to be out of school. They can just handle life a little bit better than an elementary student, per se, in the 1st grade. But the most recent data shows that half of all high schools in the US have high rates of chronic absenteeism. And if you go down to the college readiness, as you look at those days kids may miss, I think it's a big predictor on their social emotional development and those skills needed for even job placement as teenagers in high school. And we lead on to college, those lack of routines, organizational skills, and study habits, and other responsibilities that are strengthened during those high school years often affect the student level of college readiness. I've come across several students who have graduated, but they end up leaving school, or I'll say drop out of college in the 1st year because they just can't handle the routine. So we talk about that as well to our parents, principals, and our family engagement specialists, especially at the middle school and high school level. And we're asking the question, how are we preparing them? How are we really relaying the message that attendance does matter? And the more you're here, the more you can get in the routine of just being a student. And especially after the pandemic, and getting them back to having that face-to-face accountability with the teacher in the classroom. Right here, I guess I wanted to kind of tackle some of the reasons why we deal with chronic absenteeism. And, sometimes as a principal, you see a kid that's absent a lot and you're very concerned. But I always tell my team, I had an attendance committee. And first I would try to rule out any of the outliers, because we also have to understand that kids are not at a young age in elementary, maybe middle school as well, they're not solely responsible for getting themselves to school. And so you have to really be careful where you place the blame. And so I never wanted a parent to feel attacked because several things are happening. I had one family when I was a principal. I mean, they were in a homeless shelter. And I didn't know because the parent was too proud of me. And we had to really set up a situation where they have transportation, food, shelter, clothing. So when you're dealing with the person, sometimes there's more important things going on, I hate to say, than getting to school on time or at all. And so I had to really relay that message to my teachers, even when we transitioned the kid back into school. Like, this kid went through a traumatizing event of being evicted and going through this, ordeal for 1 month and finally getting back stable, now going back to school every day. Some of my kids were really traumatized by some of the things they went through. So I really tried to dig into what's going on. But we did have like physical health issues, asthma, diabetes, tooth decay, and obesity. Like, diabetes was a really huge thing at my campus. And I started having classes in a respectful tone because I did work in the food desert. I don't know if y'all know what the food desert is, but we didn't really have a lot of healthy choices. And so we did have a lot of kids that were overweight. And so I wanted to figure out a way where I could figure out, let's have a health class and cooking classes. And I had people come in and just give them healthy choices on a budget. Because sometimes we think, if I go to Whole Foods, if you go to Whole Foods, you may have one bag and you may have spent $200. I've been there. I have one little bag and I spent $200. But we really put together some pricings for them, in some scenario-based things, because you can tell a parent, you can shop and, it's not as much as you think it is, but some people are visual. And so I did have a lot of kids that even had the monitor on them where, they had really some nice technology to help them manage their diabetes. And they were really out a lot because of health issues going in and out of the hospital. So I just listed some of those, and asthma was really big, especially when the pandemic came. You didn't know whether it was COVID or asthma. So a lot of kids were out because you really couldn't tell the difference. We really didn't know what we were dealing with at that point. And so I had a lot of absenteeism because of that. Bullying. I remember having some kids that didn't want to come into the front door, that were just going through a thing or being bullied or being excluded. You know, you may have like a mean girl club. You have some boys bullying. You have all of these things going on at recess. That's why I stayed out at recess, to keep a kind of a pulse on what's going on, because some kids will come home and tell their mom, oh, I don't want to go to school. And the mom will tell me, she's never been like this. Like, this is totally new. And so we will get to the root of it. And it would be some mean girl things going on, or this is the cute girl club, you don't have nice clothes. And so we will have lessons on that. And I was really honest with my kids about some of the things the kids didn't have. Now, I didn't want to beat around the bush, you know, not with my kinder, first and second graders, more so my third, fourth, and fifth graders. And when I went over to the middle school sometimes, to really speak to them about how you can really harm a child long term with bullying, and they may not want to come to school. So all of these are predictors when you get into attendance. And you can really, in Fort Worth, I really want to look at here why kids missed or why kids received referrals, so we can kind of pinpoint like what's really going on the most in Fort Worth. Is it bullying? Is it fighting? You know, what's going on? Cyberbullying? You have a lot of things going on once you place a cell phone in the child's hand. Once again, I believe in learning together, and we still do this now. We go to the campuses now with my department, and we have classes about attendance. We host SART meetings. And so a SART meeting, I don't know if you've ever heard of that, but that's when the child is experiencing chronic absenteeism, and we will bring those parents in, and we kind of switched the narrative this year, because bringing a parent to a meeting like that, they'll think they're automatically in trouble. Or you want me to go to court, or you're trying to put some type of consequence on the reason for why my child is not coming to school. But we changed it into a class. And so it sounds, feels, and it is less punitive. And the parents know that before they come. Like, we're trying to prevent all of those things that are in your mind when it comes to the system and why or why not your child is coming to school on a regular basis. And so some of the strategies we would just talk to the parents about, talk with the child. What is the root cause? And have those candid conversations with your child about why you're not coming to school, why you're skipping, or whatever the situation may be. Contact the school. I ask the parents that you're the number one advocate. I want you to feel empowered to call the school, question us, and ask those questions as a parent, because in the end, you're the first teacher. And I always tell the parents, you're the first teacher, and we're strengthening the things you've already laid the building blocks for at home. And so staff may be able to provide additional information that helps determine why your child is missing school. Has an evaluation been discussed? Like I say, children have outside issues or indicators that are going on academically that may make them feel just, everybody wants to be successful at something, and everybody wants to feel productive. And so we kind of take this for granted with children. If I'm in a math class every day and I just can't get math and I just struggle with math, I may skip that class. I may find a way to get away from that situation. And so it's really key that I would always tell my teachers, and I tell the family engagement specialists, to always talk to the teachers and say, have those candid conversations with age groups that can handle it. Set attendance goals with your child. We will talk to the parents and talk to the child and meet with the campus and create a plan for tracking the progress, and encourage the kids and provide opportunities for conversations and support as we push on through the school year and through their time in school. Please ask me questions, because when you ask me questions and I go out in the field, it just helps me serve the community better. If you have anything on your mind about how we may be doing things, how we can do things better, because attendance has been an issue. But it's a big issue. And so if the kids are not coming to school, they're not learning. And it's not just about academics. It's about learning how to socialize. When they go to school, in these new companies, they work in teams. If you work for Google, they have a Google team working on the infrastructure. So if a kid doesn't learn how to socialize by having that opportunity, then that's going to hurt them on an interview or when they get a job. Because I've taught a room full of GT kids before, gifted and talented, and it blew my mind. Nobody wanted to work together. I go, what's wrong? I don't like him, and I work at my own pace. It was one of my challenging years because they're so smart, they're dedicated, they get everything so quick, but they like to get in their little corner and do their own thing. And if you taught a GT class or GT kids before, you know exactly what I'm talking about. They can kind of be kind of introverted a little bit, but it's fun, but it's true. So the more they're in school, the more we have opportunities to place them in situations where they can work and learn how to problem solve with their peers.
We have an opportunity for questions here in just a second. I
Great.
have a question though for you. I learned
Yes,
some really good information. I'm excited about all the work that you all are doing in the school district. Chronic absenteeism isn't just a problem, for school and parents. What can, other caring adults and providers or even community partners do to encourage attendance?
I think one thing I would do as a principal, I consider myself an advocate for the community. And I just think more people that are in that lane need to go speak in other places where there may not be a conversation, there may not be a topic. Because sometimes hearing it different from a different person, it resonates with you. Just like when I was in principal, people would come tell me about some things from a different lane. I said, oh, it makes sense to me now. And so when I would go speak in my church partners, Alta Mesa, went to St. Lutheran and Wedgwood Baptist, those are the three churches that were nestled within our neighborhood. I would always try to schedule a time to go speak to the churches, the boxing clubs. I go to the boxing clubs all the time because the boys are there. And so I would just take those opportunities to speak on their platform. And just if you just have someone's ear, we partner with children all the time. We have these classes, it's getting the word out. Because parents really think my kid can miss a couple of days and come back and be okay. But in a subject like math, I mean, even with my babies in elementary, we're on division Monday, Tuesday, Wednesday. And then on Thursday, we're doing perimeter and area. These are two different concepts. They build from one another. So when you miss time in structured subjects like that, it can cripple you for the next concept. But parents don't look at it that deeply sometimes. And so just having those real conversations is what I would say in a professional manner. You have to be really careful about maybe someone talking over their head, because a parent told me one time, I feel kind of apprehensive because I don't have a GED. Everyone is smart here. Everyone has a degree. So when I walk through the door, I automatically feel overwhelmed. But I love that honesty because it made me have a conversation with my staff. But the staff, hey, guess what the parent just told me? And we were all like, wow, I can't believe she told you that. I said, it's a lesson we all need to learn and really keep that in mind, that sometimes we can be intimidating as educators because people think we're educated. And so that's I hope I answered your question, but that's what I did, gleaning from my experience. Every time I had the opportunity to talk about it, I'm talking about it. I talked to the communications department about it. Hey, what do you guys think we can do differently for attendance? We had an Attendance Matters campaign this year that was led by Mrs. Nobia Hood. And every school got a check, like $1,500, I think $1,300 to $1,500 to help out with attendance. And I think just spreading the word, making sure Fort Worth knows that it's important. The people that are in that lane, making sure that the parents' attendance is important. Keep it on social media. And keep making sure they understand it. Because if the kid is struggling, okay, if you get them here, we can fix it. We're the specialists. But if they're not here, we can't fix it. And so that's kind of how I feel about that.
Yeah, that definitely answers my question, Brian. Thank you. And something else I said today in a previous conversation, but feels really fitting here, is that we can do more together. So when we're all having these conversations and we're speaking the same language, we can make a bigger impact. So thank you all so much. You panelists have taught me so much, and I hope that you all that are on the call have learned something, because I know that I have. I do want to just give everyone on the panel an opportunity if they have some piece of advice or information that you didn't get to share earlier, but just something to tell the parents that are listening. If you have one piece of advice, and I'm just going to go in order on my screen so we don't all talk over each other. So Dr. Fuquay, not to put you on the spot, but if you have any advice for anyone, I'd love to hear it.
Well, just listening to everyone tonight was just really awesome and makes me think that one of the things that my daughter was able to do as a chronic ill patient at Cook Children's her entire life, and she's now 19, is serving on the Youth Advisory Council. And I will say there's nothing more powerful than youth advocating for youth, advocating for what they need, what they believe, speaking up. So I know we're talking here to parents and we're trying to help parents, but as parents, we can also help kids that if they see someone struggling or they see their friend that was in class just doesn't seem to be coming, we should be talking to our kids about helping them to help their peers, right? And we talked about bullying and so many negative things, but there's so many positive things that kids can do and influence each other. They listen to each other sometimes more than they listen to us parents who really have the better knowledge for the most part. But I absolutely love it when I see a kid, just like our electronics. As a parent, I'm going to go to my kid and go, can you help me figure this out? Kids do know a lot and we need to give them credit and let them support each other. So I just wanted to kind of emphasize on that as my part, even though I'm the dentist and I should be talking about dentistry and teeth, but that's the same thing. Kids can influence kids and support each other on brushing and doing their good oral health habits, as well as all other great things they should be doing. So just wanted to add that 2 cents.
Thank you, Dr. Fuquay. I'm going and asking my 13-year-old all the time, how do I fix my phone? So I'm right there with you. They're a wealth of knowledge of the things that we may not know. Myra, what about you? Any piece of advice for our listeners?
So two things I want to say. You own these devices as parents. And so you can have a place at night where your children must check those in so that they won't have that blue light emitting at them in the night. They won't be tempted to sneak up and get back on their cell phones and talk to their friends, which could potentially cut down on bullying. So, a lot of times kids get into things after hours, right? And it gets transferred or posted the next day. And that's when the schools actually will see the results of anything that took place over the evening hours, early morning hours, over the weekend hours. So you have the right to have all passwords as a parent. So you get those. So you establish that routine of taking these devices from them in the evening. And lastly, as tempting as it might be, you want to get your kid involved in everything. You want them to be on the soccer. You want them to run track. You want them to be playing basketball. You want them to be a cheerleader. Don't overschedule your children, because guess what? That means you're overscheduled. So don't overschedule yourselves and don't overschedule your children. And so those are my parting 2 things.
Thank you, Myra. That was a lesson I learned pretty quickly with my first son when we did t-ball and soccer at the same time. And I said, never again, we will not be doing this. So that's such good advice. Marquita, do you have any advice for our listeners?
I just have a few resources for those that are interested in asthma education and asthma trigger remediation. The Center for Children's Health, it lists all of the programs within our departments, the Center for Children's Health, but just click on the asthma link and we have important information about triggers as well as videos. We discuss ways to use the inhaler, different things like that. And also the website for asthma411.org. That's important information for nurses to keep to educate themselves. So.
Thank you, Marquita. I know I've watched some of those videos to educate myself. Such helpful resource. Otis, what about you? Any words of advice for our listeners before we sign off?
Well, as a counselor, I don't like to give advice, but I just a couple things here from that perspective. Parents are the experts. They know more about their kid than anybody else. We're all just here to support parents and their kids to be successful. And I just put that out there because sometimes kids need their parents to advocate for them. and they need them to kind of force them to reach out and do things to get them back on track early, right? And the second thing, just real quickly, is that annual well child visit, your annual dental visits, not just going to the doctor when you're sick. Do those annual visits. They're so important to keep that up every year, and we've slipped way behind on that over the last couple of years, unfortunately.
Yes. Thank you so much, Otis, for that non-counselor, non-advice. Brian, any last comment you want to leave for our listeners?
I think it all sounds good. I kind of want to piggyback on what Ms. Fuquay said. I hope I'm pronouncing that right. I think it's very important. She said a very key thing of giving children a voice. I think we do overlook that sometimes. And I learned a lot from kids. I learned a lot from a kindergartner one time. I said, oh, really? He taught me a lot about, he's 5, and so just imagine, what the older secondary kids can do in high school and middle school. So I think that was a very key point, just making sure they have a voice, and kids are so different. We can't think back when we were in school and how things ran. They are totally different human beings, and that means they're totally great at what they do and how they think, and they do have a lot to give to any situation dealing with children in school.
Yes. Thank you so much.
Very great point.
Yeah. Thank you, Brian. The only thing I would end with is just to reiterate that self-care is so important. It's so important for you to take care of yourself and know that you're doing the best that you can. And if something gets pushed off tomorrow, that's okay. That is okay. You are your child's first teacher. And so doing your best shows them that they just need to do their best as well. So what that looks like may look different from day to day. All right, Elaine, I'm going to send it back over to you for our closing.
Thank you, Frances. You have done a phenomenal job as our moderator. And I want to thank all of our panelists. You guys have provided just a wealth of information. And I'm kind of like Frances. I've learned a lot just listening from you all today. And I'm excited about being able to share this out further with other parents. And thank you for attending today. And I hope you were able to take something with you as well. See you soon.